If you're thinking about why we might want to model choices, so why do we want to understand how people make choices, why we want to mathematically represent that and be able to predict what people might do in the future, is that we make choices all the time, okay? So we go to the shop, we buy products, we buy services, so we decide to travel somewhere, we decide to buy health insurance. So the one I've highlighted in red there is the one that's most relevant to what we're talking about here today, recreational cultural activities. So people decide to engage in a given activity, and what we try and do in analyzing those choices is understand, why does one person do this? Why does another person not do this? Why does one person do it many times, another person maybe only does it once a year? And which sites do people visit? We also look at social interactions, which actually is also quite relevant if you're talking about a site like Mount Stewart, that maybe people come together as a family, come together with their friends. So we're trying to understand the links between people in making those kind of decisions. So that still doesn't explain, other than a kind of like basic interest in trying to understand human behavior, why do we actually want to mathematically represent those choices? And choices drive demand, okay? So the things that we do day to day lead to demand for products, services, infrastructure, and as a result, those choices have major implications from an economic perspective, societal perspective, and environmental perspective. And I'll give you some examples in a couple of minutes, but policymakers and industry, they are very interested in this, okay? Because they need to cater that to that demand, so they need to be able to predict what is it that people are going to do in future, how might I change what people do in the future, how might I encourage additional demand. The important point there is the bullet point, various hypothetical futures. So I'm going to talk about that a little bit more later on. We might want to predict how will visitor demand change if we add new exhibitions, for example. So the current context is then understanding and predicting demand for visiting historic houses under different hypothetical futures. So the stuff that Gloria and I do day to day has two aims. So choice modeling has two big aims. One of them is understanding choices people make at the moment. So understanding why one person decides to visit a historic house, another person decides not to. Okay? What policymakers and industry use that information for is really cost-benefit analysis. So they try to understand the trade-offs that people make in making their choices and use that for cost-benefit analysis. The other aim of these models is to predict what might happen in the future. So what if I change the service I'm offering to people? What if I'm making new products available? Or what if the population changes? So what if the population gets older, gets richer, gets more informed, or people change their attitudes over time? How might that change what people do as a result? So we use that a lot in forecasting future demand, testing different scenarios. So the important point there is we'll provide you with a mathematical tool that will allow you to test different possible scenarios. So that will allow you to say, well, hypothetically, if we were to add this new exhibition, how would visitor numbers change? Okay? Rather than going and doing it and finding out that maybe people don't come to that exhibition. Okay? So current context, understanding current behavior would be understanding who visits and who doesn't visit and for what reason. And then how would visitor numbers and the demographics of visitor numbers change in the future depending on what is offered to them. So I primarily work in transport, but I also work a lot in health and environment. Gloria's done a lot of work in environment and also worked a lot with psychologists. So if you're thinking about how these models that we're talking about are used, almost all transport policy, for example, is based on these kinds of models. Okay? In health, the decisions about what treatment options to make available, a lot of that is based on understanding both patient preferences and physician preferences as well. Environment context, compensation for oil spills was based on the result of mathematical models. Why do you think, if you think you go to a large internet shop and you look at the prices, a lot of that is driven by analytical analysis of data about what consumers are actually interested in doing. Or if you design Apple brings out a new laptop or a new phone, the features and the prices of that, a lot of that is again driven by mathematical models to understand human preferences. Heritage is very much still lacking in this context, okay? Which is why we were so pleased when Joy reached out to us, and we can hopefully not only make a difference to what happens in heritage context, but also bring choice modeling into a new domain and help make a difference there. Okay, so how do we do this? So I'm going to not focus very much on the slide and the graph. I'm just going to tell you this a little bit as a story. So if you're thinking about how a real human decision maker makes a decision, like a visitor who comes to this site, well, it's a Saturday morning, it's nice and sunny outside. They say, well, what could I do with my time today? These are the different activities I could do. I'm going to compare them to each other, make some trade-offs, think about what I can do at those sites, how much it will cost me, and so on, and reach a decision. Okay? Now, I, as an analyst, and Gloria as an analyst, we will understand partly the context in which people are making those choices. So we'll observe the context a little bit, and we will observe the outcome. So we'll observe what people do. We have no idea at all what goes on up here in people's head when they make those choices, okay? And I always tell the same story. If you were to make a decision, and if I asked you to explain how you made that decision, you probably also struggle to put that into words, okay? So our job as mathematical modelers is to now come up with a mathematical model that seeks to replicate what it is that people do, and seeks to do that in such a way that makes good use of data and produces reliable results. Once we've done that, we can then use that model to understand why does a given person visit at the moment, another person does not, and again, how might that change in the future if I'm offering new services. So I've already said this. Oh, sorry, Joy, there's some equations. I really didn't mean to, it just happened. Okay, I'm not going to talk about the equations, but it's to give you the general idea that the process that people use to make a choice happens up here, happens in their brains, okay? And what we do as mathematical modelers, we create a set of equations, essentially, to put it into simple terms, that seeks to mathematically represent that process in such a way that it remains computationally tractable, but produces results that are of value, okay? So it's also in line with economic theory, in line with psychological theory and behavioral insights. And there's many different models that we can use, all with pros and cons attached to them. Thanks, Charles. Okay, so I'm going to talk a little bit about data because we'll be collecting data here and also online with a view to feeding those models, because the models are only going to be useful if we have good data feeding into the models. And I'm going to explain over the next couple of minutes two different types of data that we can use in mathematical models of human behavior. Revealed preference data, so these are choices that people have already made. Okay, so we're trying to understand choices they've already made. And stated preference data is hypothetical future choices. So revealed preference data is data on choices that people are making across different domains. Okay, so I'm only going to, let's focus on the middle example, supermarket shelves. How many of you have got a supermarket loyalty card data? Most of you. Okay, so the supermarkets know exactly what you're buying, okay, on any day of the week, and they also know what's in the shop. So they can produce mathematical models to understand what you're choosing depending on what's available, okay? There are other examples on this. The NHS collects data if they give patients choices. You switch about, changing your energy provider, for example. Or in a transport setting, we tend to give people an app on their phone that tracks them as they move, and then we try to understand the choices that they're making. Now, not all choices exist yet, okay? So we might want to look at some hypothetical future scenarios, new products being made available. And also, for many real-world choices, it can be very difficult to get data. So convincing Tesco, for example, to give us their loyalty card data I tried, and it was very difficult. I got it in the end, but it was not easy. So what we do a lot is that we work with something called stated preference data. So stated preference data puts people in the hypothetical context of making choices. So we explain those choices, the settings very carefully to them. We face them with a given scenario, and we ask them what they would prefer in that context. And then we do it again and again and again. So I've got two examples on the screen here. One of them was about flood prevention schemes. So understanding whether people would be willing to essentially pay more money to reduce the risk of flood prevention. On the right-hand side, February or March 2020, I was sat at home like everyone else while COVID was happening outside. So I did a stated preference survey with many colleagues from around the world, including Gloria, in different countries, understanding what would people's choices be once COVID vaccines became available. So this was before any vaccines were out there, understanding who would choose to be vaccinated depending on the properties of the vaccines available. And I'll get back to that in a few minutes. But let's now think about how we would do this in the context of visits to historic houses. What we've got here is an illustration of how revealed preference data and stated preference data might look in the context of such a visit to a historic house. So we have the person with the clipboard here is the interviewer, and then we have our two visitors here. A revealed preference question would, for example, be, how often have you visited this site in the last 12 months? And then in addition, we'd capture a lot of data about their sociodemographics and so on, and maybe also what other sites they have visited. So that's revealed preferences because that's choices they have already made. A stated preference setting might be, well, if these were two options available to you, visiting just a house with the garden and have to pay £15 for doing so, or having an added exhibition included in that package and paying £18 for it. Which of these two would you prefer? Now, this is a very simple setting here. I'm only showing two options, and I'm only showing these very few attributes. In reality, we can create much more complex choice scenarios for people. And then we show each person multiple such scenarios to really understand how their behavior would change depending on what's being made available to them. Okay, so why are we doing this? What do we actually get out? Once we've gone and collected a lot of data, we spend a lot of time developing these mathematical models, estimating parameters for those models on the data, we're getting results. Well, we get two core types of outputs. Now, I call the first one monetary valuation, but it's not really just monetary. It's about understanding quantitatively what are the trade-offs that people are making. So if we're thinking about a monetary setting, it would, for example, tell us how much more would people willing to pay to visit a site that has an added exhibition, okay? We can also make demand forecasts and elasticities. So we can predict how would visitor numbers change if I'm making this new exhibition available, or how elastic is the demand to changes in the price, for example, or changes in other characteristics of the service we're offering. Okay, so that's the kind of outputs that we can generate. Now, these look relatively boring, just numeric outputs, but we can go much further. So where the real power of these models lies as well in terms of user experience at the end, and when I say user, I mean the stakeholders like the National Trust, is to produce tools, interactive tools that use these results. So we haven't yet collected data on this, so we haven't got a model yet, but if this works now, I'm just going to show you how we did this in the context of the COVID vaccine study. So I told you that we collected this data on COVID vaccine preferences in 2020, and we did this in 16 different countries. Okay? We estimated models, and then we produced this tool. So what this tool now allowed us to do is to predict, before there were any vaccines, what would be the vaccine uptake under different possible future scenarios, okay? So the scenario that if you play around with that risk, and you can see how the predictions change as a result, okay? So again, we're not going to produce models here on vaccine preferences. We'll produce models understanding how people might visit historic houses. And crucially, we'll be doing that not just with current visitors, but also with current non-visitors. So to really understand, well, how could we get non-visitors to come? What we need to change in order for that to happen? And then we can produce these types of tools. So Charles has really now made the vaccine not very good. And you can see as a result, we're getting a lot of non-vaccinators. That's all from me. So again, Gloria will be really the point person in this.
We are going to incorporate many things that you were talking about, like emotional stuff, heritage sectors, well, all the heritage stuff, but linked to, I don't know, social behavior. Maybe I have here social barriers, feelings, maybe risk perception, different kind of attributes or characteristics. So you are welcome to give us some feedback if you want us to include something that we don't have in the list. So just that. Thank you.
Excellent. Thank you.